Thyroid diagnosis, testing and treatment. Diagnosis and tests. How is thyroid disease diagnosed? Thyroid disease can be difficult to diagnose. The symptoms are confusing with those of other conditions. But there are tests that can help to determine that symptoms are caused by thyroid. These tests include blood tests, imaging tests, and physical examination. One of the most definitive ways to diagnose a thyroid problem is through blood tests. Thyroid blood tests are used to tell if thyroid gland is functioning properly. They do so by measuring the amount of thyroid hormones in the blood. These tests are done by taking blood from a vein and arm. Thyroid blood tests are used to see if one has hyperthyroidism or hypothyroidism. Thyroid blood tests are used to diagnose thyroid disorders associated with hyper or hypothyroidism. These include 1. Thyroiditis, 2. Graves' disease, 3. Hashimoto's disease, 4. Goiter, 5. Thyroid nodule and 6. Thyroid cancer. The specific blood tests that will be done to test thyroid can include thyroid stimulating hormone, TSH, which is produced in the pituitary gland. It regulates the balance of thyroid hormones, including T4 and T3 in the bloodstream. This is usually the first test a doctor will do to check for thyroid hormone imbalance. Most of the time, thyroid hormone deficiency is associated with an elevated TSH level. Excess thyroid hormone is associated with a low TSH level. If TSH is abnormal, measurement of thyroid hormones directly, including T4 and T3, could be done to further evaluate. Normal TSH range for an adult, 0.40 to 4.50 μ per milliliter, milli international units per liter of blood. T4, thyroxine tests for hypothyroidism and hyperthyroidism, and used to monitor treatment of thyroid disorders. Low T4 is seen with hypothyroidism, whereas high T4 levels may indicate hyperthyroidism. Normal T4 range for an adult, 5.0 to 11.0 micrograms per deciliter of blood. FT4, free T4 or free thyroxine is a method of measuring T4. It eliminates the effect of proteins that naturally bind T4 and may prevent accurate measurement. Normal FT4 range for an adult, 0.9 to 1.7 nanograms per deciliter of blood. Triiodothyronine. T3, triiodothyronine tests help diagnose hyperthyroidism or to show the severity of hyperthyroidism. Low T3 levels can be observed in hypothyroidism. But this test is useful in the diagnosis and management of hyperthyroidism, where T3 levels are elevated. Normal T3 range, 100 to 200 nanograms per deciliter of blood. FT3, free T3 or free triiodothyronine is a method of measuring T3. It eliminates the effect of proteins that naturally bind T3 and may prevent accurate measurement. Normal FT3 range, 2.3 to 4.1 picograms per milliliter of blood. These tests alone aren't meant to diagnose any illness. They may prompt the doctor to do additional testing to evaluate for a possible thyroid disorder. Additional blood tests might include thyroid antibodies. These tests help identify different types of autoimmune thyroid conditions. Common thyroid antibody tests include microsomol antibodies. They are also known as thyroid peroxidase antibodies or TPO antibodies. 2. Thyroglobulin antibodies, also known as TG antibodies. 3. Thyroid receptor antibodies, includes thyroid stimulating immunoglobulins, TSI. And 4. Thyroid blocking immunoglobulins, TBI. Calcitonin, this test is used to diagnose C-cell hyperplasia and medullary thyroid cancer. They are both rare thyroid disorders. Thyroglobulin, this test is used to diagnose thyroiditis, thyroid inflammation. It is also done to monitor treatment of thyroid cancer. Imaging tests. In many cases, taking a look at the thyroid itself can answer a lot of questions. Doctor might do an imaging test called a thyroid scan. This allows the doctor to look at your thyroid to check for an increased size, shape or growths, nodules. Doctor could also use an imaging test called an ultrasound. This is a diagnostic procedure that transmits high-frequency sound waves through body tissues. They are inaudible to the human ear. Ultrasound. The echoes are recorded and transformed into video or photographic images. One may think of ultrasounds related to pregnancy, but they are used to diagnose many different issues. Unlike X-rays, ultrasounds do not use radiation. There's typically little or no preparation before an ultrasound. One need not to change their diet beforehand or fast. During the test, one has to lie flat on a padded examining table. Their head is positioned on a pillow so that the head is tilted back. A warm, water-soluble gel is applied to the skin over the area that's being examined. This gel won't hurt the skin or stain the clothes. Doctor will then apply a probe to the neck and gently move it around to see all parts of the thyroid. An ultrasound typically takes about 20 to 30 minutes. Management and treatment. How is thyroid disease treated? Doctor's goal is to return patients' thyroid hormone levels to normal. This can be done in a variety of ways. Each specific treatment will depend on the cause of patient's thyroid condition. Physical exam. Another way to quickly check the thyroid is with a physical exam in the doctor's clinic. This is a very simple and painless test where the doctor feels patient's neck for any growths or enlargement of the thyroid. If one has high levels of thyroid hormones, hyperthyroidism, treatment options can include anti-thyroid drugs, methimazole and propylthiouracil. These are medications that stop the thyroid from making hormones. Radioactive iodine, this treatment damages the cells of the thyroid. Thereby it prevents it from making high levels of thyroid hormones. Beta blockers, these medications don't change the amount of hormones in the body, but they help control the symptoms. Surgery, a more permanent form of treatment, doctor may surgically remove patient's thyroid, thyroidectomy. This will stop it from creating hormones. However, one need to take thyroid replacement hormones for the rest of their life. Hypothyroidism. If one has low levels of thyroid hormones, hypothyroidism, the main treatment option is thyroid replacement medication. This drug is a synthetic, man-made, way to add thyroid hormones back into the body. One drug that's commonly used is called levothyroxine. By using a medication, one can control thyroid disease and live a normal life. Are there different types of thyroid removal surgery? If doctor may determine that a patient thyroid needs to be removed, there are a couple of ways that can be done. The thyroid may need to be completely removed or just partially. This will depend on the severity of a patient's condition. The thyroid could be very big, enlarged, or has a lot of growths on it. This could prevent one from being eligible for some types of surgery. The surgery to remove the thyroid is called a thyroidectomy. There are two main ways this surgery can be done. 1. With an incision on the front of a patient's neck. 2. With an incision in the armpit. The incision on the front of the neck is more of the traditional version of a thyroidectomy. It allows the surgeon to go straight in and remove the thyroid. In many cases, this might be the best option. One may need this approach if their thyroid is particularly big or has a lot of larger nodules. Alternatively, there is a version of the thyroid removal surgery, in that the surgeon makes an incision in the armpit and then creates a tunnel to the thyroid. This tunnel is made with a special tool called an elevated retractor. It creates an opening that connects the incision in the armpit with the neck. The surgeon will use a robotic arm that will move through the tunnel to get to the thyroid. Once there, it can remove the thyroid back through the tunnel and out of the incision in the armpit. This procedure is often called scarless because the incision is under the armpit and out of sight. However, it's more complicated for the surgeon and the tunnel is more invasive for the patient. Thyroid removal. One may not be a candidate for this type of thyroid removal if they 1. Are not at a healthy body weight. 2. Have large thyroid nodules. 3. Have a condition like thyroiditis or Graves' disease. A patient can talk to their doctor about all of their treatment options and the best type of surgery for them. How long does it take to recover from thyroid surgery, thyroidectomy? It will take one's body a few weeks to recover after their thyroid is surgically removed, thyroidectomy. During this time they should avoid a few things, including 1. Submerging their incision underwater. 2. Lifting an object that's heavier than 15 pounds. 3. Doing more than light exercise. This generally lasts for about 2 weeks. After that, one can return to their normal activities. Outlook/prognosis. How long after the thyroid is removed will the tiredness go away? Typically, one will be given medication to help with their symptoms right after surgery. The body actually has thyroid hormone still circulating throughout it, even after the thyroid has been removed. The hormones can still be in the body for 2 to 3 weeks. Medication will reintroduce new hormones into the body after the thyroid has been removed. They may be still feeling tired after the surgery. But this could be a normal part of recovering from any type of surgery. It takes time for the body to heal. One can consult the doctor if they are still experiencing fatigue and other symptoms of thyroid disease after surgery. If a part of one's thyroid is surgically removed, will the other part be able to make enough thyroid hormones to keep one off of medication? Sometimes, the surgeon may be able to remove part of the thyroid and leave the other part so that it can continue to create and release thyroid hormones. This is most likely in situations where one has a nodule that's causing the thyroid problem. About 75% of people who have only one side of the thyroid removed are able to make enough thyroid hormone after surgery without hormone replacement therapy.